Welcome. Good morning, good afternoon, and perhaps good evening to everybody. I am Chris Sarlis. I am the director of the Health Campaign Effectiveness Coalition. And on behalf of the coalition and the Task Force for Global Health, I want to welcome you to today's webinar. We're excited to have so many colleagues from around the world joining us to explore CAS.tools, which is a practical resource package that's developed to support the Collaborative Action Strategy for Campaign Effectiveness, or CAS. As we get started today, I see a few people are already starting to introduce themselves in the chat. So let us know your name and where you're joining from. Also, this is a webinar, so I want to invite everyone to use the Q&A function, which is one of the buttons on the bottom, if you want to pose questions, and you can do that at any time throughout the session. So let's have the first slide, the agenda. So the purpose of today's webinar is twofold. First, it's to provide you with a walkthrough of CAS.tools. And these tools are available on the HCE Coalition's Campaign Effectiveness website. I think our agenda is just lagging behind a little bit, but that's okay. The second purpose for today is we'd like to gather any input that you would have from these tools, as well as future resources. There we go. That could be developed for the coalition. So for our agenda, I'm going to start off with a very brief overview for those of you that are perhaps new to the Collaborative Action Strategy. And then I'm going to turn it over to our colleagues from the Canberra Collective, who've been very instrumental in working with us and the countries and our team in putting these resources together. They're going to give you a brief overview of the types of tools that are included in the website, and then provide a more detailed walkthrough of selected resources. And again, please feel free throughout the session to ask questions, and then we reserved the last 10 to 15 minutes for discussion and Q&A. And great, I see a lot of people joining from all over the world. So the CAS.tools that you see today are ones that we've used and curated over the past year as we've been supporting the governments of Ethiopia and Nigeria in the process of customizing and launching their collaborative action strategies. So this is a work in progress, and we'll be adding to the tools in the coming months. And as other countries decide to adopt the CAS, we invite you also to use and customize these materials to fit your needs, and also to feel free to add new tools to our resources so everyone has access to them. So before we actually jump into the actual tools, I want to do a quick orientation of the Collaborative Action Strategy, but first let's do a poll to find out how familiar you are with the CAS. So take a few minutes, we're going to pause and give us a rating on your familiarity with the Collaborative Action Strategy. It's okay if you've never heard of it, or it's okay if you're very familiar. So take a few minutes. Looks like quite a few of you that have never heard of it. Okay, great. I will give you a very quick overview. Or you don't know much about it. That's why you're here. And then quite a range to some that have actually already using it. So fantastic. Well, I'm going to close this down. And good time to give you a quick overview for many of you that don't know about the Collaborative Action Strategy. So the Collaborative Action Strategy is the HCE Coalition's 5-year strategy, and it's designed to guide global health organizations, partners, governments to a future state where health campaigns collaborate effectively with each other and with the corresponding health services to maximize impact and efficiency. So the strategy was co-developed in 2023 by more than 50 global, regional, and country-level experts that they represented from governments, organizations, funders, implementers from all over the major different campaign program domains, including vaccine preventable diseases, polio, entities, malaria, and nutrition. So we had quite a lot of people that worked to co-create this. The recommendations in the CAS are grounded in credible evidence and best practices, and many of those were identified through the coalition's learning events and implementation research studies. And the CAS is meant to complement existing disease-specific strategies, such as the Immunization Agenda 2030 or the NTD Roadmap, or other strategy documents for malaria, polio, and nutrition. Adopting the CAS is voluntary for countries who desire a new way of working together across disease programs, whether it's to improve coordination, communication, streamline redundant processes, or if they're aiming for a more integrated campaign delivery approach. You can access and download the full strategy and the overview deck from our website, and we'll go ahead and put a link to that in the chat. That's okay, you can go ahead, next slide. As I mentioned, the CAS is intended to be adaptable and customizable to each country's context and priorities, and the tools that we'll be sharing today are meant to help countries get started in this process. So the strategy includes 12 recommendations that address 3 broad areas: campaign planning and implementation, monitoring, evaluation, research, learning, and adaptation, which we call MERLA for short, and campaign financing. And so in the interest of the time today, I'm not going to walk through all of these 12 recommendations, but if you'd like detailed descriptions, you can also listen to a webinar that we gave on March 6th, which is available on our website. We can put the link to that. And then the full strategy document, which we'll also link to, has many details and suggestions for stakeholders on how to implement the recommendations. And several of the tools, CAS tools that we're going to talk about today are directly linked to these recommendations, and we'll go ahead and point that out along the way. Next slide. So after approving the CAS in December 2023, the coalition's leadership team recommended a phased approach for its implementation. The first phase began in January of 2024 when we launched the CAS at a meeting in Addis Ababa, where we were joined by representatives from the Ministries of Health in Nigeria and Ethiopia, who both opted in to be the first countries to implement the CAS. We consider these first few years a proof of concept or demonstration phase for the CAS, where we'll focus on learning and adapting before going to scale in the latter years. So as a result, you'll see today, the examples that you're going to see today come from the experiences of working with these 2 initial focus countries. I'm also very pleased to say that in just 1 year, significant progress has been made. To begin with, each country spent considerable time socializing the CAS principles with their stakeholders and gathering their interest and input on the feasibility of adopting the CAS. This helped them to identify both the opportunities and the potential risks to implementing CAS recommendations. And it was really necessary to ensure full partner buy-in before moving forward. Today's webinar will share methodology and the tools and examples from the 2 countries who conducted their initial feasibility assessments. Each country then used the information from these assessments to bring their partners together through a highly collaborative process to customize the CAS recommendations, to align them to their own priorities, and then they developed detailed and costed implementation plans. CAS.tools includes several example templates, tips, and workshop planning resources that can help you get started in the CAS customization and implementation planning process. At this time, both countries have also started implementing several of the recommendations, especially the first ones that call for forming a campaign steering committee or a coordinating body, developing a shared campaign calendar, or identifying integration opportunities. So we'll share today some examples of how they did that. Finally, you can see from the timeline that we're still in early implementation. In the coming months, the coalition will be hosting a webinar to share information from the financing analyses and policy solutions that Nigeria and Ethiopia have undertaken, as well as we'll be sharing the learnings and the results of their integrated campaigns. So stay tuned for future webinars in the coming months. The coalition is here to support countries in CAS planning and to facilitate the learning process. As we move further into CAS implementation, and as other countries choose to adopt the CAS, we'll be adding resources to the CAS toolkit. So I'm now going to turn it to my colleague, Brent McCann from the Canberra Collective, who will begin our CAS tours. Thank you very much.
Great, thanks so much, Chris. So first, I just want to orient you to the CAS.tools package that's on the HC Coalition website. The CAS.tools, as I said, is a package of knowledge, resources, and tools generated from CAS planning, customization, and implementation in Ethiopia and Nigeria, the two focus countries. Stakeholders can use the CAS tools to help customize and implement the CAS in their own country or context, and I'll talk about that in more detail here in just a second. I just want to also orient you to the QR code on the left. So obviously you can go to HC Coalition CAS.tools, or you can use the QR code. Next slide, please. So CAS.tools or CAS.tools is organized into 4 phases, and each phase includes downloadable resources to guide you through real decision points wherever you're at in this process. I'll walk through a few of the selected CAS tools, and so you can see them in action today, along with my colleague Matthew. And those are the ones that are currently highlighted in blue. All of these tools are designed to be adapted, meaning they are not one size fits all, as Chris mentioned, and can help countries at any point in the campaign integration process. So phase one helps determine whether CAS is a good fit. Tools in this section include a country readiness assessment, feasibility protocol, which we will take a look at today, and materials to support stakeholder consultations, such as interview guides and reflex session templates. Phase 2 is all about tailoring the CAS to your country's context. This includes identifying specific stakeholders, adapting language, and setting up timelines. Here you will find a customization template, sample products from Nigeria and Ethiopia, and methods that can be used to gather feedback. In phase 3, the focus then shifts to how the strategy will actually be implemented. So this is specifically planning and organization as a precursor step to implementation. Here you will find a campaign characterization form, which we'll demonstrate today. Talk a bit about today, an implementation plan template, which is the how are we going to implement based on the CAS, and materials to run implementation workshops. This helps define roles, resources, and sequencing. Then finally, phase 4 is about putting your customized CAS into action. Some countries begin some of these steps while still planning. That's totally fine. I want to note that you can parallel process some of these steps and use these tools along the way. There are tools here for forming a campaign coordination body, reflecting on progress, and making overall improvements. So together, let's look at an example of a feasibility assessment, which is a critical step in phase 1, and I'll pass it over to my colleague Matthew for that.
Thank you so much, Brent. I think, Patricia, did you want to show what the CAS.tools website looked like before I jump into the feasibility assessment? All right, so here you can see what it looks like. We have the 4 phases. If we go a little down on the page that my colleague Brent just mentioned, and on the right side, so you have the description for the phase and instructions about what is included in that phase, lessons learned from the implementation of that phase in our focus countries, and you have the supporting resources on the right side that you can click, and you will have access to each of those tools. And as my colleague Brent just mentioned, we will go into the feasibility assessment right now. So let me share my screen again. There we go. All right, perfect. So the feasibility assessment is one of the foundational tools in phase 1. This is the first step that we have undertaken in both our focus countries, and we will take about 10 minutes to go through the components of this tool and showcase a few examples of the results and what it has been used for. So the feasibility assessment is designed to consider the stakeholders' needs, the opportunities, the risks, the challenges to CAS implementation, and how CAS recommendations fit into country contexts. So first, it helps develop a snapshot of the current state of campaigns in the country. This includes looking at capacity, existing delivery platforms, and available resources, and what would be needed to support CAS execution. Secondly, it identifies who's already involved in campaigns and who needs to be engaged, mapping out current and required partners. Third, it helps surface key risks, challenges, and opportunities for CAS implementation, giving countries a realistic understanding of what might support or hinder the efforts in CAS customization and implementation. And finally, the process produces context-specific recommendations by assessing the feasibility and the sequencing of the components of the CAS. So the idea here is that it's not just about can we do this, but also when and how can we do this. So to gather this information, the feasibility assessment draws on 3 core methods. The first one is campaign validation, which involves collecting and cross-checking data on past and ongoing campaigns, which builds on accurate picture of what's happening and where overlaps or gaps may exist. For the focus countries, what we did was to use the campaign hub that is also available on the HC Coalition website, and we cross-checked with interviews. So interviews that are conducted with national and subnational Ministry of Health stakeholders and key partners, with the goal being to hear directly from those involved in campaign delivery. And the final method that we undertook, and we suggest to undertake should you do a feasibility assessment yourself, is to go through existing strategic documents, reports, and planning materials to review them and collect information and see where you have commonalities in domain-specific plans and other strategic documents. So what I will do now is to go through very quickly the results from the feasibility assessment we did for Ethiopia. This is what I think is pasted in the chat, and this is what you will find on the CAS.tools webpage. The goal is not to go through the content in itself. We have, as mentioned, a webinar from March when we discussed the progress in both focus countries. And if you have any questions, you can reach out to the coalition, and it is available on the website, but it's just to show you what the results look like. So generally, the way the feasibility assessments that were done so far were organized was around an executive summary with the key messages, the objectives and the methodology that I just mentioned, a campaign overview, a SWOT analysis, and then recommendations. In terms of messaging, this is something like this, with a key message showing the strength that we witnessed in the country and the challenges that will need to be overtaken to implement and customize the CAS. For example, in Ethiopia, we've seen strong political will, experience, an opportunity for information sharing, but as well limited bandwidth and fatigue because of the high number of campaigns. You will find in the example of the feasibility assessment the list of the people we interviewed. I will again not spend too much time on it, but this is to show you what kind of people that were interviewed. So it's generally the heads of the key departments in the Ministry of Health, the public health agencies, the regional or subnational level people, and key partners. For example, in Ethiopia, we engage with the Carter Center, the Bill and Melinda Gates Foundation, UNICEF, the CDC, and Gavi. What the snapshot of the campaigns can look like is something like this, with a compilation of the number of campaigns, where they happened, and what type of campaigns have been undertaken in the past couple of years. For example, in Ethiopia, we saw that NTDs and polio were the major domains, and that integrated campaigns were limited. This, of course, will depend on your country. And we have also included an example of what stakeholder mapping could look like for Ethiopia. As I mentioned, the key results of the feasibility assessment are messages on the strength, the weaknesses, the opportunities, and the threats in the country, and recommendations about how to undertake the recommendations from the CAS. For example, here in Ethiopia, we identify 3 key phases. The first one being what we call the enabling phase, socializing, sharing information about the CAS, trying to bring together a common vision of campaigns into a shared plan. The second phase on initiation, so that is identifying integration opportunities, when they could be integrated, aligning the processes across the campaigns, and having a systematized plan for integration. And then a third phase with intensification, scaling up of the new practices, systemized collaboration, and harmonization of funding practices and logistics, which takes a little bit more time. So I will take a pause, a 1 or 2 minute pause to take questions on the feasibility assessment and the feasibility phase before handing it over again to my colleague Brent to talk about the campaign calendar. I don't see any questions, so Brent, you want to start
Sure.
in the campaign calendar?
Thanks, Matthew. And if there are any questions on the feasibility assessment, we can take a pause after my next section here and answer those as well, as folks start to spin up and ask questions if they have them. So for the next 5 minutes or so, I'm going to talk a bit about another tool that we used or that has been used during the CAS planning and implementation process. Matthew, next slide, please. So it's a campaign calendar tool that is available to support country campaign planning and collaboration. I'll just say before we get into the nuts and bolts of this campaign calendar, I would personally argue that after political will and stakeholder buy-in, which is obviously critically important, the next most critical aspect for a successful CAS is developing communication and visibility across the Ministry of Health departments and relevant partners. And this campaign calendar tool supports that. So just really quickly, what is this campaign calendar integration tool? Well, it helps identify where campaigns are happening, what campaigns are happening and who they are targeting, as well as which campaigns have integration potential, which we'll get into a little bit further in the campaign matrix that Matthew will share, and who is funding the campaigns. Next slide, please, Matthew. Great, thanks. So I'll just quickly walk through the tool that was used and is being used in Nigeria. Thanks, Matthew. So this campaign mapping integration tool, as I said, is currently being piloted in Nigeria, and it's designed to help countries map all of their health campaigns across disease areas, which you see there, geographies, delivery platforms, and partners all in one place. This gives a clear view of the current campaign landscape, leading to better alignment in campaign planning and avoidance of duplication, and identifies clear opportunities for timely coordination and integration. I will also say that for this tool to be effective, it needs strong alignment with national campaign planning systems, as well as dedicated focal points that provide regular updates from relevant departments, So all in all, that means the data needs to be regularly updated and the map customized to include critical and important details. So whether you're trying to identify scheduling conflicts, align training and logistics, or decide where joint planning makes sense, this tool gives you a centralized way to move forward. It was critically important, I would say, in Nigeria to identify the campaign opportunities for integration in 2025. The precursor to this lovely tool that you see in front of you was an Excel spreadsheet. So just wanted to note that while I think this tool is the best case example of a tool, an Excel spreadsheet, which you can find on the CAS.tools website, is available as well. Next slide, Matthew. So just really quickly before I turn it back to Matthew to walk through our third and final tool, this timeline gives us a snapshot of the many campaigns and campaign-related activities that are already scheduled or anticipated in Nigeria in 2025. And this was derived from the campaign calendar and the campaign calendar process. As you can see, there's significant activity throughout the year, including polio, malaria, immunization, and maternal and child health campaigns. Periods of high activity, particularly in April, May, September, and October, show where multiple campaigns could overlap. We also need geographical data or location data, which we have in the campaign calendar as well, to identify where there's opportunities for integration. And just so you know, work is currently being done with the HCDA to support the integration of 4 states based on the mapping, and that hopefully will occur in October. Matthew, back to you.
Thank you, Brent. So we can take a minute or two if you have any question on this calendar and how it has been used so far. I saw some questions about the impact of coverage on integrated campaigns and historical data comparing planned or implemented campaigns over the years. Those two things, so my colleagues from Task Force will draft an answer to those two questions, but we did not include these questions in the feasibility assessments, but we do intend to monitor those lessons, and some of it has been studied as well by Task Force in the implementation research that it has done before implementing the CAS. So if you have any questions on the campaign calendar, feel free to put in the Q&A function, and I will shortly move into our last tool of the day. All right. So the last tool we wanted to show to you today is the campaign characterization tool and the integration matrix that we have used in both our focus countries, and how the tool can support countries in identifying where campaign integration is most feasible. The integration matrix is a 4-step process that helps map out similarities and differences between campaigns and highlights practical opportunities to integrate, because integration does not only include co-delivery, but it can also be overarching tasks such as communication or transportation or training that could be done together even when campaigns are not co-delivered. So the way it was done is that information is first gathered on each campaign health domains, including targets, teams, timelines, funding, and planning processes, creating a clear view of how campaigns are structured and delivered. Then the shared practices are considered. For example, do campaigns use the same training methods or delivery teams? Then using the integration matrix that I will show you in a minute, broader opportunities such as tools or systems that could be used across all campaigns, regardless of disease area or target group, can be explored. And finally, the process helps identifying specific campaigns that could be co-delivered. So that's planned and implemented together to reduce the burden on both communities and health workers. So what is included in CAS.tools is a form that helped us build this integration matrix that is pretty straightforward. It's a list of all campaign components that can be sorted by disease domain so that we can effectively visualize where harmonization might be possible, or collaboration at the very least. And campaign components can be easily adapted to various program contexts and desired areas of integration. So what is on the CAS.tools website is a very straightforward Word format form with the list of the criteria that we have used to build this matrix. Here you see a screenshot of what that form looks like. It includes space to describe the target population, geography, frequency, point of delivery, everything that is included in the matrix. And I won't spend too much time because it is quite straightforward, but I will get into how it has been used in both our focus countries, so Nigeria and Ethiopia, and what that has led to. Here, in this opportunities matrix from Nigeria, you can see that most campaign domains, such as polio, malaria, and TDs, have modalities like delivery points, team composition, and training that have similar practices, and where collaboration and integration can be considered and potentially take place. So using those opportunities that were identified, discussions from the technical working group tasked with customizing and implementing CAS in Nigeria have given key insights into how campaigns might be integrated or co-delivered this year. 4 overarching areas stood out where all the campaigns could potentially collaborate on or align, and that is sharing the micro planning, the advocacy, communication, and social mobilization activities, training of health workers and teams, and transportation logistics, where all areas that showed to offer high potential for shared planning and implementation across campaigns. In addition, some criteria were used to identify which campaigns could be co-delivered, and the criteria to identify those campaigns are geography and target population. So are we going in the same place to see the same people, timing, drug compatibility, and resource availability, so that campaigns that should be co-delivered would effectively be possibly co-delivered in an efficient way without compromising the objectives of each campaign domain and the coverage of the campaigns. You have a very similar example in Ethiopia as well. You can see that similar opportunities from integration arise across domains and showcase a similar potential for harmonization, communication, supervision, data collection, training, and the supplies processes are common and similar across the campaign domains. So the technical working group from the Ethiopian Ministry of Health have used this characterization matrix to get a clear view on what can be integrated across health campaigns in Ethiopia. And it is quite similar to what was done in Nigeria as well. Training, job aids, communication methods, data collection tools, logistics, and supervision were shown to be 6 areas with similar practices and opportunities for integration for all campaigns, regardless of whether they are co-delivered or not. And as was shown earlier in the matrix, microplanning differed across all campaigns. So there is an opportunity to streamline these practices, but that needed additional work. And similarly, these discussions have uncovered opportunities for co-delivery in Ethiopia using very similar criteria. So intervention compatibility, point of delivery, timing, team sustainability, and geography. And 5 groups of campaigns have been selected by the Ethiopian Ministry of Health to happen potentially together using the point of delivery as a key criteria. So we have bundles on fixed site, house to house, school or community-based. And this was used very early on. There currently is a big integrated co-delivered campaign in Ethiopia that is I think just finished, that has used this matrix and is part of this. And you will probably see communications about this. So this is a tool that has helped select what could be integrated or where collaboration could arise and where co-delivery opportunities could happen. We, the coalition generally will, as mentioned in the introduction, continue to update the CAS.tools and lessons on how that has gone and what we can learn from this focus country phase will be shared in upcoming webinars in a moment. And I will hand it back to my colleagues from Task Force to facilitate the Q&A moment.
Thank you very much, Matthew. Thank you very much, Matthew. And again, thank you very much to everyone for joining today's CAS walkthrough. So at this moment, we would like to hear from you and get inputs on how these resources can support your work. To start, we are going to launch a very quick poll. And it's really focused on, for those considering adopting the CAS, to what extent do you think these tools and resources will be helpful in getting started? So that's the first question, and we'll give a moment just to respond. All right, so let's take a look at some of the responses that we see. So given the responses in terms of what is the extent of people utilizing some of these tools, we do see a good number that are interested, from 3 to 5. And when we now look at our feasibility assessments and seeing how helpful it is encouraging that we see that more than 70% of people see that it is very helpful or helpful. And for the campaign calendar, we also see similar, if not higher numbers. And with regards to the campaign characterization tool, we also see a great number, more than 80%, also 76% also seeing it to be helpful or very helpful. So I guess we'll now go to our next poll question as a follow-up, which is really focused on which of the following tools or resources would be most helpful to you? In regards to this question, I think we would like to hear from colleagues at this point, just seeing from the chat. Please feel free also to unmute yourselves or share your inputs through the chat as well in terms of what your perspectives are about the utility of some of these resources. And as well as if you have any questions, we can also respond to the utility of these tools. And in addition to that, I guess we can also now speak about our second question, which is really focused on what support or adaptations would help you to be able to use the CAS tools more effectively at work. We see that we have a very broad spread of stakeholders. I see some of us coming from the donor space. I see some of us coming from as program managers within the countries working with the government, as well as implementing partners. So given the rich diversity of stakeholders, I think it would be very interesting for us to hear from you all about what are some of the things that may be required in addition to just some of these tools that we should also consider to really help your work and really help you to utilize these tools more effectively. Yeah, so at this point, we'll just be looking within the chats and also to see if there are colleagues who are interested in raising hands as well to also be unmuted. Okay, we do have one person that does have their hand up. That is Mohammed Musa Abu Bakr.
I don't think he's able to speak in the webinar, Destiny. So perhaps could use the chat.
Okay, that's fine. All right, sincere apologies, Mr. Mohammed. If you can kindly write your message in the chat, we'll be able to respond accordingly. Okay, so I guess we'll use the last few minutes going beyond these questions just to hear from colleagues if there are any other additional questions, whether about the tools themselves or how to be able to access them. We know that as we've been going through the course of the webinar, we've been sharing a number of links and as well as we dropped them in the chat. So if there are questions on how to find specific tools, specific documents, or how to open them or access them, or anything that we've discussed today, please write in the chat and we'll be able to respond to you accordingly. So I guess at this moment, while we are waiting for some of the questions, I guess we can also look at what are some that have been answered already. Just to take us back to our earlier questions that we received, there was a question from William Brieger that was, is the tools geared to service delivery? And then that's in reference to the feasibility presentation that was made on Bennett distribution to information and mobilization for vaccines or something quite different. So in response to this, Ali had thanked him for the response, and I had mentioned that if we're not sure, yes, you can drop your message in the question and answer chat, or as well as in the chat, whatever one approach you feel most comfortable with. So in referring to the feasibility assessment, the campaign calendar, but BedNet distributions are included as one of the campaigns that are tracked. Both the campaign calendars and feasibility assessments look at high-level detail campaigns, though you can see Matthew is now presenting some tools and processes that deep dive into the campaign details. The tools are first intended to facilitate visibility across the health campaign programs for coordinated planning. Then we also have a second question, which I had responded to with regards to Alex's question about if the feasibility assessment had data that captured coverage for integrated campaigns and some of the different components. So if you recall earlier in Chris's presentation, she had showcased that we have 12 recommendations, and under the recommendations related to MERLA, we have a recommendation 2C, which is framed around understanding how measuring campaign effectiveness looks like. Currently, right now, the Health Campaign Coalition, in collaboration with UNICEF, is working closely to develop guidance and also to document and share some of the case studies from our focus countries, as well as some of the other countries that are supported by UNICEF, to really understand and deep dive what does campaign effectiveness measurement look like for integrated campaigns. Also, not only looking at coverage, but also looking at other domains that are in relation to what you have presented, and also just reflecting on what those trade-offs mean so that countries can be able to effectively determine how they would utilize and select the key measures to be able to effectively measure campaign effectiveness within their context. For Rakesh, we do see that there is a question as well in relation to historical data and comparing that with some of the looking at planned campaigns and what that looks like for the ones that were actually implemented. And if we have plans to integrate post-campaign surveys within regards to this. So I think because of the sake of time, I would allow us to kind of read through what some of the existing responses are. But I think if for some of the open questions that we have, I think we'll just go over and hand them over to have other colleagues to be able to respond accordingly. So we can start with the question from Alex that was presented. He said, can you talk about the donor interviews and their willingness to fund campaign activities that are more expensive because they are integrated with the diseases that are not their priorities? So I guess this is in relation to our experience with conducting the feasibility assessment and collecting that information and perspective. So I guess at this point, I would be handing over to Matthew and as well as Brent to share what was that experience like getting perspective from the donors. Over.
Thanks, Destiny. This is a difficult question to answer. I would say that during the feasibility assessment, the feedback that we got from donors and key stakeholders was their willingness to integrate and their articulation that integration is a priority. I think it's become even more of a priority given the funding cuts that have happened in the space. I think there's always some resistance or hesitation when, and this speaks to one of the other questions that was asked in the Q&A. There's always some hesitation when there's a concern that the effectiveness of a campaign could decrease. But I would say that for the majority, if not all of the organizations and funders that are part of the HC Coalition and the leadership team, they've been very supportive of campaigns around the CAS.
Thank you very much, Brent. And I see that you're also already starting to respond to David's question. So maybe you can also just voice over to that with regards to what drawbacks to integration were identified in Nigeria and Ethiopia going through the CAS process. Any pushback at the community level, for example, or concerns by EPI and malaria program managers?
Yeah, thanks, Destiny, for flagging that. There's two that stood out, and I spoke to one already, which was there was a concern at the national or partner level around a potential decrease in the effectiveness or the efficiency of campaigns. And the other was at the community level. I think there was some concern around decreased compensation. Both of those were flagged in the feasibility assessment.
And I will add just one thing. Thank you, Brent, for the very clear answer. On the funding side of things, it has been the most challenging part of the feasibility assessment in terms of collecting information and seeing the shifts that could or couldn't happen. So for both our focus countries, Nigeria and Ethiopia, there has been a specific finance assessment that was undertaken by another consulting firm called Sedani. And as Chris has hinted in her introduction, there will be elements shared about this soon. And there was also a dedicated solutioning meeting, which is a big workshop with partners to tackle this question of how to fund campaigns that will be potentially more expensive at first because they are integrated without jeopardizing the objectives and the funding structures so far.
Thank you very much, Matthew. I see we do have another question coming in from Cosmos. So impressive presentation and very timely, given the current global health funding space, are there any case studies demonstrating cost efficiency of integrated campaigns compared to running separate standalone interventions, campaigns in silos, NTDs, and malaria? So given just kind of in relation to the response I have given, is that currently we don't have any studies that have been conducted. However, what has been mentioned before is that under our recommendation 2C, we are working to develop a framework to be able to effectively measure some of the different domains of campaign effectiveness. And one of the areas that is an area of interest, of course, is efficiency. So in relation to this, one of the plans is that while we are documenting the use cases and the information that is going to be coming out from the countries, both our focal countries and also countries of interest for UNICEF, I believe there are some insights that we can draw to be able to provide more light in response to this particular question. Okay, we have another question from Philip. It says, even when overarching integration opportunities have been identified, do issues of who or which campaign control resource been a barrier? And if so, how has these barriers been addressed with support of this tool? So my reference, I think, is this would be related to the, I assume, is it the calendar? The calendar, is it in reference to that, or?
I think so, Chi-Chi, or Destiny, but Chi-Chi also has her hand up. Maybe she might want to jump in on that one.
Okay, over to you, Chi-Chi.
Thanks, Destiny. So in reference to the question by Philip, this is actually one of the things that we are working through now with Nigeria as they are planning the integration of multiple campaigns in the 4 pilot states, as was earlier mentioned. One of the things that is going on in Nigeria, especially with the measles rubella campaign, the government is trying to see how feasible it would be to integrate NTD and malaria campaigns in these select states, as well as polio. And I think one of the biggest challenges we're having, for example, is like team selection, or which teams will go with who. In terms of like the ACSM teams, can they come together? Do they have enough resources to do 10 days for that measles campaign will run versus 7 days that was originally planned for the NTD campaign? So these issues are arising, but the great thing is that leveraging on this tool, what we're trying to do is really identify areas of synergy. And when we talk about integration, we're not actually talking about code delivery alone, but the process of actually seeing what's feasible, excuse me, what's feasible for integration, whether it is just the planning phase or even if it's the communication, the advocacy piece, or the micro planning, just the different elements of integrating a particular campaign. That is the process is already starting at the national level, just kind of understanding some of the barriers to integration or what is feasible to integrate as we go along this journey of piloting in the 4 states. Over.
Thank you very much, Chi-Chi. We do have, just want to also share and flag with us that there are a series of studies and assessments that have been done in relation to integration and what that looks like across different contexts in multiple countries. And our director has dropped in the chat where you can access some of these studies and assessments for us to have questions related to coverage, co-delivery, and other aspects of what integration may entail. So if we look in the chat, we can see that the link has been dropped. So you can go to campaigneffectiveness.org and go to knowledge base, and you will see some of the resources across different topics. So that's also in a way to kind of speak to Ayana's question. Now, there's another question from Margaret that says, do you know if any examples of countries that have a unit or a district or regional level responsible for managing campaigns? Chi-Chi, would you like to speak to this?
And maybe while Chi-Chi's getting ready to respond, thanks in advance, Chi-Chi. Maggie also dropped a little bit more context in the chat, Destiny, so I'm happy to just read that out. She said, my question, whether there are units in or at district health offices whose role it is to manage campaigns, comes from thinking that tools are important, and it is also important to have government workers in roles that can use them. What efforts are there in ministries of health in relations to making these structural changes?
Thanks for the additional details, Margaret. So, uh, again, what we are doing now with the CAS tools and the implementation plan is really just kind of starting from the national level. A lot of that sort of integration idea, socialization, and understanding of what is required has already happened. The next phase, which has started, is at the state level, where the state actors like the directors of public health and the technical officers, the state primary health care executives have all been sort of oriented on this process. And we are kind of using the same platform, the same system that had been introduced at the national level to engage with the states. And as we are approaching the piloting of CAS, that movement is going rather quickly along the planning for the MR campaign. So essentially, within our implementation process, we haven't actually gotten to the point of reaching the communities. That's what we are systematically doing now as we're planning for this integration effort with the MR campaign. Over.
Thank you very much, Chi-Chi. I see we just have maybe the opportunity to take one more question, given time. So I think, or maybe we'll try and take two. So we have a question here from Anita that says, have we thought about the logistics of commodities and availability of commodities because delays or non-availability could hinder integration?
I think that was one of the challenges we've had with having the NTD campaigns in the calendar. I think someone asked a question about why aren't the NTD campaigns in the campaign calendar. This was one of the reasons, the logistics of actually knowing when the shipments will arrive. And as many of you may be aware, the NTD campaigns, though they are planned for a certain quarter, the actual implementation doesn't happen until the products arrive in country. So those were expected by this summer, I think by June, July, or August. And so the challenge with NTDs is, yes, we plan to have them integrated, but the risk also is the logistics. Would they arrive on time? And would they be available at the last mile for the actual integration process to occur? But what we are doing is, beyond just the logistics, is actually working with the different teams to plan, to see what's feasible. How do we, again, we talked about like the social mobilization piece, how are we bringing our teams together? So a lot of the SCSM teams are already working together to ensure that there is like a cohesion in the communication on the campaign. So there's different elements that are working on, but the logistics is a challenge that the country is trying to resolve at the moment. Over.
Thank you very much, Chi-Chi. I see, I see one more. I think we'll take this one and then we'll just have to wrap up. We will follow up with responses. You can reach out to us for further questions. But the question, just to have the opportunity for another respondent, is from Dr. Osita Okonkwo. So it says, how would integration work for time-sensitive interventions like vitamin A supplementation campaigns that are scheduled for May, June, and November, December in Nigeria? The vitamin A supplementation campaigns in Nigeria as such that various states have varying campaign dates occasioned by resource constraints across states.
Destiny, I can jump in and try to answer that. It's a challenging question, but can I go ahead?
Yes, please.
I would say that and then we shared the campaign calendar previously. What's critical for identifying where to integrate campaigns in 2025 and moving forward is doing so early in the year, and the identification of overlap both in terms of timing but also location. And that was essentially where the Ministry of Health and the NPHCDA landed for the pilot state integration in October, that there was overlap across multiple campaign domains happening in similar geographies, both from a timing perspective, but also from a geography perspective. To answer that question specifically, I think it would all come down to planning and pre-planning and understanding where there is potential overlaps across geographies and across timing as well. Over.
Thank you very much, Brent. For the sake of time, we are going to have to close. It's 9. But first and foremost, we want to thank you again for all who have attended today's sessions. And we appreciate the time that you've taken to participate in this walkthrough to really understand our tools and also how this knowledge base can support your planning and your work around health campaigns. So again, thank you to all of our colleagues around the world. It's been great to see such strong interest and engagement across program, countries, and organizations. If you have any follow-up questions, please do not hesitate to reach out to our team. You can visit the CAS webpage, which has been dropped, to download the resources and access guidance. And as well as, I don't know if it's on the screen, but we do have our email, our campaign effectiveness email, which can be accessed. Thank you, Patricia, for dropping it in the chat if there are any other questions. And on behalf of the Health Campaign Effectiveness Coalition, thanks again, and we look forward to continuing the important work together. Thank you.
Thanks, everybody, and we'll get a copy of the recording and again, access to the slides coming out shortly. Thank you.